you want your career to have ultimate meaning, you have to pass along your wisdom and your love of the specialty to sort of inspire other people to get into it.
I think that that handing down of knowledge over the generations is very much alive in the society.
It's the idea that you're still active, that you're interested. And to see the young researchers come up and bring in a contribution, and you see them coming along with their little round things that they're carrying their posters in, it's just a wonderful process.
And so you take a lot of pride in helping other trainees, yet alone in your clinical practice, and the trainee kind of appreciates the extra time you took, so it's sort of a two-way street, if you will, and so that builds strong relationships. So even if people move to other institutions, there's always this sort of circling back around. And I think also partly because the specialty does involve a lot of complex medical things that, talking to someone who's seen something before or done it before is very instructive to you, and you remember that. And then you suddenly become the expert because you have a little more gray hair, or you're now the senior guy, and you don't realize it just sort of happens. And I think I've personally experienced that. I've been in the field for about 20 years now, and my goal is I've accomplished quite a bit with publications and grants and presentations. My goal is I'm actually happier trying to help the next guy coming up through fellowship. So I think that 20-year cycle sort of makes sense from a lot of us doing academic hepatology, and the people who keep coming up seem to have the same bend for whatever reason.
So this idea of fostering young talent and promoting early career support via funding, via mentorship, via linking mentees and mentors is extraordinarily important, because there is a relatively short institutional memory in hepatology, because most of our mentors who were the first generation of hepatologists trained a relatively small number of people that are now at our mid-career point. And we've gotten all so busy because hepatology is now such a booming, vibrant, active discipline, and liver transplantation is such a widely used treatment. But we still need an institution and an organization that can provide that early career mentorship and support.